It's a battle in terms of like shifting an entire culture's perspective because it's so ingrained in people to automatically make assumptions around the size of somebody's body and their health. And it's like we've always talked about, like we narrow down health to the way somebody looks, diet, and exercise, and that's it. Yeah. And then we put that back on the person like it's their fault. And what I hear you saying, and what we've talked about a lot on this podcast, is like, stop doing that. Let's look at the whole wheel of wellness. Yeah. And there are actual things that impact people's health that we have control over, that are really meaningful, and stop putting energy and attention over here, put it over there.
Yeah. And I would say also, not to mention that so much of our health is not under our control. I think that in our culture, we really have this myth of personal responsibility around our health. Whereas if you look at kind of that pie chart of what actually determines our health, for example, like socioeconomic status is one of the biggest impacts of health, as well as our genetics. So those are two things that people don't have a tremendous amount of control over. And yet we tend to blame ourselves, if we get sick or develop diabetes or have a medical condition.